So welcome back, everyone. Welcome back our virtual audience. Our next session is on facilitating gluten-free dietary adherence through culinary medicine. And we're going to start with talking about adherence itself and why it's important. Our speaker is Dr. Dascha Weir. Dascha is a pediatric gastroenterologist with special expertise in celiac disease in children. She's the clinical director of the celiac disease program at Boston Children's Hospital and is also the medical advisor of the Celiac Kids Connection Support Group. Finally, she's a member of the executive committee of the Harvard Medical School Research and Education Program. So without further ado, Dascha.
Thanks, Alan, for that introduction. It's great to be here. Can everybody hear me okay? So today I'm talking about why adherence is important, which is actually a somewhat complicated topic. The objectives today, I'm going to cover and describe the complexities related to adherence to a gluten-free diet. I'm going to identify some long-term effects of ongoing gluten exposure, and I'm going to review quickly facilitators and barriers to successful long-term adherence, some of which you've already heard about. So we all know that the current treatment for celiac disease is a strict lifelong adherence to a gluten-free diet, which is defined by the FDA as less than 20 parts per million. And research tells us that most adults and children on a gluten-free diet get mucosal healing and restoration of small bowel architecture. This happens more quickly and at higher rates in children than adults, and is not 100%. And I don't have to tell many of you in this group that strict adherence to a gluten-free diet is difficult. This is for a very complex range of psychosocial, logistical, and financial reasons. And looking at the medical literature, we see that there is a very wide variance of adherence rates, both adults and children, and that in children, the median rate in North America has been found to be 70%, and that there's increased vulnerability in teens. Now, these varied rates are likely factored in by individual. We're all individuals, and every individual has different challenges, but it's also related to how they are asked about their adherence and what specifically they are asked. Which brings me to thinking a little bit about definitions. So when we think about what is non-adherence, in medicine, we think about this very basically as when recommended prescribed treatment is not followed. So it goes to say that when we're talking about celiac disease, we're talking about when a strict gluten-free diet is not observed. But this is not a binary issue. This is not a yes, you're adherent or no, you're not adherent. There's a lot of nuance. And there's when the strain from the gluten-free diet can happen in a lot of different ways. Gluten ingestion can be inadvertent. It can be intentional. It can be small amounts. It can be large amounts. It can be occasional or it can be frequent. And it can be recognized and it can be undetected. And clearly, these different ways that people are exposed to gluten can have different downstream effects. And a lot of questions are around how much gluten and how often is the gluten present. So in thinking about gluten exposure and how much is too much, there were some important micro-challenges studies that have been done, which looked and showed that 50 milligrams of daily gluten over a 3-month period seems to induce intestinal damage, and that 10 milligrams or less likely does not. There's also been some really important research by my colleague, Dr. Sylvester, and her team in the doggy bag study, and also studies looking at gluten immunogenic peptides, which can be found in stool and urine, that show that inadvertent small gluten ingestion seems to be fairly common. It can be silent and is often silent, and occurs even among those who self-rate themselves as having good adherence. And there seems to be some discordance between gluten exposures and intestinal healing. So it's difficult for us to know the clinical significance of all of these gluten exposures that happen. So what we're coming to realize is that even the strictest gluten-free diet is not likely 100% gluten-free. And I think this phrase, aspirational rather than attainable, sort of captures this concern. And the amount of gluten exposure in everyday gluten-free life is challenging to quantify, tricky to recognize, and the risk and effect is not fully understood and may vary among individuals. And I think it's important to also recognize, while we're having this discussion, is that extreme hypervigilance is associated with psychosocial burden and may cause more harm than benefit. And this is certainly an area that our clinical team thinks a lot about. So adherence is tricky. For patients in the real life setting, it can be difficult to achieve. For doctors, providers, and dietitians, in the clinical setting, it can be difficult to monitor. And for our researchers in the research setting, it can be difficult to study. But we still recommend and we still strive to good adherence for a gluten-free diet. It's clear that duration, frequency, and amount of gluten exposure matter. And while that threshold of where that is, there's still some questions around that. We know that when that threshold is crossed, the gluten exposure does lead to ongoing active celiac disease and mucosal damage. And so the current prescription for celiac disease remains: avoid knowingly eating gluten and take care to reduce cross-contact while trying to avoid unnecessary hypervigilance. And we recognize this is a hard path to walk sometimes, and we encourage you to reach out to your clinical team for support if you're struggling on that path. And the reason why we recommend this is because sustained mucosal intestinal damage has negative health effects, which seem to be related to chronic inflammation, nutritional deficiencies, and immune response in tissues. So I'm going to shift now and talk a little bit about some of these health effects. It's a lot to cover in the time that we have. So I'm going to focus on some specific long-term health effects of continued exposure to gluten, where we have evidence that a gluten-free diet helps. So the first one I'm going to talk about is one of the most striking ones, which gets everybody's attention quickly, and that is mortality and celiac disease. I will start by saying that life-threatening complications related to celiac disease are rare and occur in less than 1% of patients with celiac disease, but there does seem to be higher mortality in patients who have a later diagnosis after age 50 and those who are not following a strict gluten-free diet. Some studies have shown up to a 2-fold increase in death rates. Others show smaller to no increased risk, and this may be related to increased awareness and better and earlier diagnosis. And the evidence suggests that risk is lessened by adoption of a gluten-free diet, and mucosal recovery reduces the rate of all-cause mortality. So that's, I think, a really important point. Cancer is one of the areas that affects this mortality the most. And there are 2 specific types of cancer that I wanted to touch on today. I will say that as a pediatrician, I do not deal with this in my practice, fortunately, but it remains an issue that I think we all need to think about when we're treating celiac disease. Small intestinal lymphoma in patients with celiac disease, there is an increased incidence, 6 to 9% higher than in the general population. Delayed diagnosis and delayed treatment are associated with increased risk of this type of cancer. Small bowel adenocarcinoma is very rare. It's rare in the United States, but there's a 60 to 80-fold increased relative risk associated with a delay in celiac diagnosis and poor adherence to a gluten-free diet. These cancer risks, there is a protective effect of a strict gluten-free diet. A much more common issue with celiac disease and ongoing gluten exposure is nutritional deficiencies. Highly prevalent at the time of diagnosis in both children and adults. And the most frequently described deficiencies in celiac disease patients at diagnosis are iron, vitamin D, calcium, vitamin B12, folic acid, and zinc. And this is a little cartoon that shows the effects in the body of some of these long-term nutrient deficiencies, including anemia and bone health. Initiation of a strict gluten-free diet leads to improvement. This may occur more readily in children than adults. And there can still be long-term nutritional deficiencies, which is why we recommend the ongoing involvement of specialized dietitians, why we recommend a nutrient-dense gluten-free diet, and why we recommend multivitamins and supplements as indicated. The other big one that is the big issue facing patients, particularly children with celiac disease, that is highly influenced by initiation of a gluten-free diet is growth. As pediatricians, we think about growth and weight gain a lot. A third of children with celiac disease present with either short stature and or weight failure or weight loss or failure to gain. And we do see improved growth on initiation of a gluten-free diet. By year 1, the majority of children will show normal linear growth rate and return to normal weight curves. And in year 2 to 3, in some children, we'll see catch-up linear growth as well. Bone health is another really big issue that I spend a lot of time in my practice thinking about. We know that low bone mineral density is commonly seen in children and in adults with celiac disease. And I've learned from my bone specialist colleagues at Boston Children's Hospital that 90% of peak bone mass is acquired by 18 years of age. And we see improved bone mass and normalization of bone on a gluten-free diet. So this is a really big reason why we want our patients to be on a gluten-free diet and why we want to identify celiac disease early. This is not just an issue, though, for teenagers and for children. There have been studies in adults, and one example is a study of Swedish adults where their persistent mucosal damage was associated with increased risk of hip fractures. Reproductive health is another area of concern. Celiac disease is associated with shortened fertile period, absence of menstruation, and recurrent pregnancy loss. There's mixed evidence regarding increased prevalence of celiac disease in women with infertility, but it remains an area of concern. And there are higher risks of obstetric complications, specifically preterm birth, intrauterine growth restriction, stillbirth, low birth weight, and small for gestational age. And the evidence shows us that treatment with a gluten-free diet can lead to significant decrease of preterm delivery specifically. Some of our patients with celiac disease have a dual diagnosis and also have type 1 diabetes. And evidence is emerging that patients with type 1 diabetes and celiac disease have earlier and increased risk of microvascular complications such as retinopathy and nephropathy, that's eye disease and kidney disease. An initiation of a gluten-free diet seems to lower the incidence of these microvascular and also macrovascular complications that involve coronary arteries, peripheral vascular disease, and stroke. There are inconclusive findings regarding the effects of a gluten-free diet on glycemic index, insulin dosage, and hypoglycemic episodes, but we do anecdotally see patients who seem to have improvement in these when they initiate a gluten-free diet. And there seems to be evidence pointing towards adherence to a gluten-free diet may improve the quality of life in patients with dual diagnosis as well. I think the biggest motivator, and which is to help people maintain a gluten-free diet, is control of their symptoms. So you see here a list of some common GI symptoms and also non-GI based symptoms, certainly not an exhaustive list. And the reality is that symptoms improve and or resolve in the majority of adults and children on a gluten-free diet. And this is a really big reason to be on a gluten-free diet. Feeling better is something that we see and has been documented in adults, that those patients with a good gluten-free diet adherence had improved health-related quality of life scores compared to those with poor adherence or no adherence. And I think this can extend to our patients who are asymptomatic. The first point I'll make is that some of these patients may not truly be asymptomatic. I think many of us in clinical practice has the experience of patients who we did not know or did not identify as having symptoms come back once they've been on a gluten-free diet, report very real improvements, either in their energy, in their mood overall, maybe their track times are faster. And I think that this is really an important issue to take into account when we think about patients who are labeled asymptomatic. There's also some evidence that the gluten-free diet is associated with improved quality of life, even in screen-detected adults. So those are adults who were not found because of their symptoms, but were found on screening, so presumably had lower symptoms at baseline. It's important to recognize that there are other causes that can trigger ongoing symptoms in patients with celiac disease, even who are on a strict gluten-free diet. But the gluten exposure is one of the leading reasons for these ongoing symptoms, both in children and in adults. So there's still some unknowns, but I think we have compelling evidence that maintaining a strict gluten-free diet improves health in a number of ways. But we know that successful adherence is difficult, but we do understand some of the facilitators and barriers that can affect adherence. And we've heard about some of those already, and we'll hear about some of them later. But facilitators, increased education, increased knowledge of a gluten-free diet, increased intention or self-regulatory efficacy, and membership to a celiac association can all help. We know that some barriers to adherence are poor patient education, lower knowledge base, restaurant use, and lower motivation and food insecurity, as you've heard about already. And so all of us work very hard to make gluten-free education accessible and up to date, to improve food access, to encourage patients to join celiac associations and be involved, and to work with restaurants to make them safer and more inclusive for patients and families with celiac disease. And the reason why we do all of this is because maintaining good gluten adherence to a gluten-free diet is a worthwhile endeavor and adventure. And the gluten-free diet promotes improvements in many facets of health. It's not easy, but it's worth it. And so we are here on the path with you to try to help make this as easy and as successful as possible. Thanks.
Thanks, Dr. Weir. Our next speaker is Sharon Weston. She's a board certified specialist in pediatric nutrition. She's chef coaching certified. Nice. Through Harvard Medical School and has been in practice. It's not believable for the number of years, so I'm not going to mention it. She especially enjoys working with patients who have a dual diagnosis of celiac disease and type 1 diabetes, and she's going to give her tack on improving gluten-free dietary adherence. Sharon.
Thank you very much. All right, so my objectives today are to really describe nutrition assessment methods that we're going to use to improve adherence for a gluten-free diet, identify nutrition interventions to improve adherence, and review a real-life case study that will show successful improvement in adherence. And my disclosures are just that I have been a speaker for SHAR in the past, and I also was a grant recipient that helped provide support for the work that we do at the food pantry with our cooking classes. So we'll just start off with a case. So this is a 14-year-old female who was diagnosed with type 1 diabetes 18 months prior to her diagnosis with newly diagnosed celiac disease, and also a history of being a very picky eater and has some challenges managing anxiety as well. And when she first presented, her diet recall included regular intake of gluten-containing foods. Her parents reported that they're just not ready for switching to a gluten-free diet yet. And symptoms at that time included bloating, constipation, and also irregular blood glucose levels, which were related to her type 1 diabetes. So usually dietitians talk about nutrition assessment first and then go into dietary interventions. And I'm going to do the flip-flop here. So I'm going to talk a little about interventions first. And that kind of helps us to steer what questions to ask when we're doing our assessment with our patient. So one of the first things that we always want to think about is nutrition education regarding a gluten-free diet. And this is a very important, timely matter. So at Boston Children's, we try to have these Going Gluten-Free classes offered by Zoom weekly to our patients. They can be interpreter enabled. They cover a comprehensive instruction about going gluten-free, everything from food label reading and ingredients to avoid to just ways to manage different meals and school and activities. And there's always a guest appearance from someone from the Celiac Kids Connection, just introducing that. So that nutrition education class is really important. We also have a specific class once a month for our patients with dual diagnosis that really introduces the gluten-free diet in the context of having type 1 diabetes. Another intervention that's very important, as Dr. Du had spoken about earlier, is just optimizing access to gluten-free food. It's really difficult to follow a gluten-free diet if you cannot access gluten-free food. So it's important for screening to be done universally, frequently by multiple providers to determine families that have a need. And then we can come up with resources that will optimize that access to gluten-free food, whether it's using food pantries or delivery products with different options, even just accessing meals at school. So different ways to optimizing access to gluten-free foods. Also, improving culinary knowledge is another way to improve dietary adherence as an intervention. And so culinary knowledge means that we're really providing an increased competence level to our families to cook gluten-free, because cooking gluten-free is not the same as cooking gluten-containing recipes. And so understanding tips and different ingredients and different methods will increase that or improve that competence level. And that in turn increases confidence in making these gluten-free recipes at home. And that in turn really increases just doing it more often. So using prepackaged meals less often, eating out less often. We know that when you do that and you make more things at home, your nutrition level improves in terms of reducing the risk for contamination, cross-contamination, improves your intake of fruits and vegetables, reduces saturated fat and sodium. And so all of that works together to improve dietary adherence. Also providing strategies for families that are leading busy schedules. I mean, this is life, right? So handling different schedules, going different sports and activities and dance and things on the weekends and family gatherings. So, so just addressing those different busy life activities and coming up with strategies to best handle them on a gluten-free diet, as well as tips for eating out and traveling. So providing information on using different apps, different resources, different support groups to find what are the best places to go when you're traveling can also be helpful in improving adherence. Also social events in two different ways. So how do you manage social events on a gluten-free diet, and also improving access to social events that you feel comfortable with going to, like today. So, so that's another just way to improve adherence. And the last thing is improving that follow-up with monitoring and frequent follow-up. So access by Zoom instead of having to travel in person, because the more frequent monitoring and follow-up that's done just will also improve dietary adherence. So in regards to now knowing all of those things, when we meet with our patients and do our nutrition assessments, there's lots of different things that you think about in your head to ask the right kind of questions. So first off is a detailed diet history when we do our dietary recall. And so that includes not only going through the day's intake, but kind of matching it with patient symptoms, patient's confidence levels with complying to a gluten-free diet, talking about the impact that the gluten-free diet has on quality of life. Also, I always make sure that we do a macro and a micronutrient analysis of a typical day's intake to just really focus on the quality of the diet and fill in those holes if we need to for our vitamins and minerals. And then also just focus on reviewing healthy eating patterns. Are there major food groups that are being missed? Are we taking advantage of naturally gluten-free foods? And then also assessing supplement usage and making sure that everything's gluten-free, and also just making recommendations for necessary supplements as needed. Also in the nutrition assessment, we want to make sure that we're looking at just eating pattern preferences. So with regards to picky eating, trying to work on different strategies to expand dietary repertoire, talking about family dynamics and just understanding the different individual needs of families and helping, and then also focusing on habits. So meals on the go, meal skipping, and coming up with strategies for that. The nutrition assessment also looks at both home eating habits as well as out of the home eating habits. So again, talking about the confidence level with following a gluten-free diet and really providing that education and support to improve that confidence level. talking about our other family members following either a gluten-free diet or other dietary restrictions, so that you can help, again, come up with different recipes or different strategies to meet the needs for just cooking in the home or packing things for different meals and snacks. Many children that we work with have more than one household when they're going to each parent's home. And so making sure that both sides of the homes have a good understanding of how to do the gluten-free diet well. It also might include extended family members. Grandparents might be doing a lot of the cooking. And so again, educating everybody all on those different levels. Again, increasing competence in gluten-free recipes, and even just talking about time management skills. So planning ahead can really help with success. Out of the home eating habits, again, we want to focus on like our school meals being taken advantage of to provide breakfast and lunch now. And if kids are not utilizing that, why are they not? So even working with the schools and their food service as well. Out of the home eating habits with takeout frequency is another important thing to just educate families on, so that we're really ensuring that good practices are being done to make sure that those foods are gluten-free. And again, working with extended family members, and then just, talk about weekend eating, travel, all of the different things that come up with life. We also want to assess psychological factors. So just motivation to change and follow that gluten-free diet, and being ready to do that. And then finally, accessing social support, because we know that support from family and friends and healthcare providers is so crucial for success. And so really taking advantage of the different opportunities that we can provide social support to our patients is important. So at Boston Children's, we've got our Family Food Connections food pantry, and we've been doing cooking classes. And this information on this slide just shows the 6-month data that was collected from January to June of this past year. Our classes are offered monthly by Zoom. They can be watched live or as a recorded version later, whatever's convenient. And so the total class views for those 6 classes was 738. Our average views for class was 123, and the highest class view was 213 views. And our classes really just cover a variety of topics. They include 3 recipes per class. They also provide an opportunity for non-intentional learning. So we've got a lot of different questions that might come up in the chat. And as well as I try to gear the instruction towards talking about different topics of the month. So in January, we talked about the use of legumes to boost fiber. February was food label reading and candy about Valentine's Day. March was St. Patrick's Day and gluten-free recipes that were associated with that holiday. April was exploring gluten-free grains. May was a plant-forward diet to focus on the anti-inflammatory method of eating. And June was just talking about oats and including gluten-free oats in the gluten-free diet. So back to our case. So our 14-year-old and ended up attending the dual diagnosis type 1 diabetes celiac class and really got a good understanding of how to go gluten-free. They joined the Celiac Kids Connection, and were in contact with the dual diagnosis liaison pretty quickly. And that also gave them a lot more support, knowing that there were other kids out there with the same dual diagnosis. They met individually with their dietitian and helped find reasonable substitutes for foods that were typically consumed. And 1 month after follow-up, she had transitioned 100% to a gluten-free diet, felt remarkably better with GI symptoms, but also her blood glucose data was significantly improved. And they registered for the monthly cooking classes to learn new recipes, and the parents reported that she's so much more comfortable and doesn't want to eat gluten-containing foods anymore. So thank you.
Thanks, Sharon. Our next speaker really does not need an introduction. Vanessa Weisbrod is the Director of Education and Community Engagement for the Boston Children's Hospital Celiac Disease Program. She is also a certified chef educator through Harvard Medical School and the Institute for Lifestyle Medicine, and sits on the executive committee of the Harvard Medical School Celiac Research and Education Program. She is the host of Raising Celiac, which is a podcast series that I recommend to all of you. And she has also authored 4 gluten-free cookbooks. Vanessa.
Thank you, Alan. And thank you to my assistant, Eileen, who is handing out the recipes that are going to go along with today's session. So before I get started, just a few disclosures for our whole panel. The work that we do and much of our program is funded by SHAR USA, the Celiac Disease Foundation, and Celiac Cruise. So thank you to all of them. So I am going to talk about ways to make the gluten-free diet a little bit easier. Oh, there we go. So what are some barriers that we have to cooking gluten-free at home? We have limited time. We're not really confident in how we cook. We lack the skills to cook well. We really miss gluten. Does anyone miss gluten? I know, I mean, I've had celiac for 20 years and I still miss gluten. We're worried about cross contact, or we can't afford the food. You've already heard about the cost of food today, and you're going to hear more about cross contact. So I'm not going to talk more about those, but I will talk about the others. So how do we stretch our time? This is really hard to do. We're all very, very busy. We have lots of things going on all the time. But some things that can help with this is blocking time on our calendar for meal prep, preparing and organizing ingredients ahead of time. So when you start actually cooking, you're not doing all of the steps all at the same time, utilizing leftovers or repurposing them in new dishes, and batch cooking and freezing those ingredients or storing them in the refrigerator so they're ready to go. So I probably shouldn't be telling you this, but I'm going to anyways, since my boss is sitting right up here at the table. But this is a real life shot of me prepping dinner. So when I sat down to think about my personal time, I saw that on some weeks I had anywhere from 2 to 6 hours of meetings that required me to be a passive participant. I needed to listen, I needed to pay attention, but I didn't have to be on camera and I didn't need to be speaking or taking notes. And so I started during our hospital grand rounds, prepping dinner, prepping all of the ingredients and having everything ready to go. We can all watch Alan's face. It's okay, right, Alan? And then when my 2 little children who just joined us here today get home from school and there's soccer practice and all these things happening, and I need to make dinner quickly, everything is prepped and chopped and ready to go, and dinner happens a lot quicker. We also want to build culinary confidence, like Sharon talked about, and there's lots of ways to do this. You can take a gluten-free cooking class, watch cooking videos online. There are millions of videos online. Even on our CKC, Celiac Kids Connection Facebook page, there are tons of them. Just taste new foods and new recipes all the time. Test out those recipes on supportive friends and family. Don't try that new recipe when you're hosting a really big dinner party at your house. Do it on people that love you no matter what and will give you honest feedback on it. Subscribe to food magazines. I get way too many of them, but I absolutely love reading them for inspiration. And probably most importantly, set realistic goals that you can actually achieve. Don't decide to change your entire culinary approach in one day. Do small things over time so that you don't get overwhelmed. So there are also lots of ways to inspire kids in the kitchen. So one thing that I like to do is plate with purpose. So the picture up here is of a taco salad, which I like to eat all tossed together, but my kids are not going to eat it when everything is combined. So I use the same exact ingredients and just set them all separately on the plate. And over time, they'll get used to eating all of the ingredients and slowly start to mimic how mom and dad eat them. So a really great thing to try. The right tools are really important in getting kids in the kitchen, and they make tools for cooking for all shapes and sizes and ages and disabilities. So the one you see up here is of 2 girls of different ages, one using a more advanced grater and one using one that sets on top and has plastic surrounding it so they can't scrape their fingers on it. Also, picking the right jobs are super important. So with little kids, picking things that they can do really well and not completely mess up the recipe that you're trying to make. So one of my favorite things to do is hang out in the cookbook aisle of a bookstore and just flip through the pages. I like to take my kids and let them find books that inspire them. I like finding books that inspire me too. And so it's always fun to just go and sit down in Barnes and Noble and read a good book. Perhaps something that I think about all the time is the mess. So when we cook with kids, things are going to be messy. And it's hard to be okay with your kitchen having food coloring all over the place and flour all over the counters and the cabinets and the refrigerator. But I would just ask you to try and not let the mess bother you, but instead think about how your kids interacting with food is actually going to help them in the long run be more explorative eaters and be engaged with their food. We can always clean up. We can also put down tarps, parchment paper, and lots of ways to try and mitigate the mess in the process. Also, I know that grocery shopping can be challenging with kids, but I think it's one of the best ways to get kids excited about food. Let them go through the aisles, let them pick something new on every trip. But the deal is that if they pick it, they actually have to eat it. They can't get home and decide that they're not going to try it later. They have to agree to try it. Planting a garden is such a fulfilling thing to do. So you can start really small and plant things like cucumbers and tomatoes, or get to having a large garden with all sorts of herbs and things. Peas, my kids love growing snap peas in our backyard. And then they get to go out and pick them and then eat them for dinner. You can also visit local orchards all over New England and all over the country. This is a picture of them picking strawberries. But every season has new things that you can go and pick, and it can be really fun to go to the farms, to see how they grow things, learn from them, and also taste the different foods at the farm. And finally, food is art. So there's lots of cool art projects on Pinterest that you can do with kids. One of my favorite things to do is put down just big sheets of white paper on the table and then set a platter of food in the middle and have crayons all around and let the kids color and actually make a mural underneath the food that's there. It's an interactive way to get them, doing something around the food. It also lets the grownups talk kind of on their own if there's kids and adults together. But it also, that you'll be really inspired by the types of art that they create when they're looking at the food. You can also make things like a veggie turkey platter. Every holiday has them, Christmas tree veggie designs. Pinterest will be your friend in looking for food art projects. So you miss gluten. Not that many of you raised your hands, but I'm willing to bet that a lot of you are lying about missing gluten. So if you are missing gluten and you're just too shy to raise your hand right now, remember that you are healthy. You have a treatment for your disease. There are lots of delicious gluten-free options, and we promise to try and have celiac smarts in person every year, so you can have all of those amazing pastries and donuts and the lunch that's just a few minutes away. And if all else fails, you can watch this video. And so finally, I'm going to talk just briefly about batch cooking and get to our cooking demo so that we can all get to lunch. So batch cooking is when you make large batches of food or ingredients that can then be used as components in future meals. This is something that can be so helpful in making delicious meals and not taking all night. So it's just some things to think about. You don't want to overcomplicate it. We want to keep things simple. You don't always need a recipe. You'll see from the recipes I'm going to talk about in a moment that you can just throw ingredients together. Always make extra. Don't make enough for just one night. Make it for several days so that it's already ready to go. And then when you're batch cooking, avoid things that are going to wilt or turn slimy because you won't like them the next day and then it'll go to waste. So some examples are compound butters. So these are super, super easy to make. The first one is a lemon basil compound butter. It's just a mixture of basil leaves, lemon zest, lemon juice, salt, and butter. You can even use any dairy-free butter that you want. You can put it on things like chicken wings, grilled chicken, or vegetables, and it tastes amazing. This is a paprika and herb compound butter. It's great on steaks, hamburgers, and stirred into risotto, or a ginger cilantro compound butter, which is great with fish, shrimp, or in a fried rice. Rotisserie chicken. This is my favorite thing. You can roast chicken so quickly in the oven, or you can buy them, and there are lots of gluten-free versions in grocery stores. I will not mention specific brand names, but very large stores where you can get large chickens are awesome. They have 10 cups of chicken. That goes a really long way in making dinner. So some ideas for rotisserie chicken: Mexican pizzas with rotisserie chicken and pineapple avocado salsa, Thai chili chicken pizzas with rotisserie chicken and a tangy cucumber slaw, lettuce wraps with rotisserie chicken, creamy slaw, and sriracha mayo, and sesame soy fried rice with rotisserie chicken and sugar snap peas. And finally, the recipe we're going to demo today: mashed butternut squash with caramelized onions. This is super easy to make. You're going to see the demo in a second. You can make rotisserie chicken and butternut squash enchiladas, caramelized squash and caramelized onion risotto, grilled cheese with butternut squash and Gruyere, or even a butternut squash and goat cheese quiche. So let's learn how to make it. Oh, and everybody should have the recipes for this on your table in front of you so you can take them home. For those of you online, they're in the resources section, so be sure to grab those. So far, but I'm really excited to start. So I am a very busy soccer mom. I coach both of my kids' teams, the 2nd grade team and the 4th grade team. Like, so older son does club soccer. We average 4 soccer games a weekend, and so we're really busy. So we batch cooking and meal prep is extremely important to me. So today we're going to make the mashed butternut squash and caramelized onions to put in our butternut squash with them. And don't worry, this is 3-4 minutes. We will be on 2 days, so we will tell how to prepare. So to get started, I have 2 pounds of chopped up butternut squash. You can see these are chopped up into about 1-inch cubes. Total non-fat, I actually bought this from Costco already chopped up. You can buy butternut squash and chop it yourself, but well, I'm just gonna find that. It takes a long time to peel it, a long time to chop it, it's hard to do. This is a whole lot easier. So I'm gonna do a little bit of extra virgin olive oil for the butternut squash, about 2 to 3 tablespoons. I'm gonna season it with a little bit of salt and some sweet paprika. You can use any type of paprika. So with paprika, you want it a little silkier. I like sweet. That's what we're gonna do on. We're gonna toss this all together to get the seasoning to coat all of the squash. And then we're gonna pour it out our baby sweet, which I love. We're adding some oil so the squash doesn't stick. I have already heated my oven to 450 degrees Fahrenheit, and I'm gonna pop the squash in the oven for about 20 to 25 minutes until it's nice and hot and it starts to burn. So let's go ahead and put it in here. All right, while the squash is baking, you're gonna go ahead and get started on the family. So in this pot, I'm going to put 2 tablespoons of olive oil. That's gonna heat up, and 2 olive oil. This is just 1 sweet yellow onion that I cut into little slices here. It doesn't really have to be perfect because this is eventually going to get all mashed up. So I'm gonna add the onions into the oil. And with the onions, we're gonna put just a little bit of a pinch of salt. I am not the person who stands here measuring everything to a T when I'm cooking. Baking I measure, but for cooking dinner, I don't do it quite so much. So just a couple pinches of salt in with that. And we're going to let these sweat and cook for about 10 to 12 minutes until they are nice and soft. All right, so our onions are very soft and are starting to caramelize. So I turned the heat down now to low. And I'm going to add in some chopped garlic. We're just going to cook this for about a minute until it is nice and fragrant. This is fresh garlic. I love chopping up fresh garlic. It smells so delicious and I think it tastes better in food. But of course, if you want to save time, you can also buy the pre-minced garlic. It comes in like an oily substance that you could use as well, or you could use garlic paste, which will definitely save you a couple of minutes of chopping. But you cannot any other way get that beautiful fragrant garlic smell than using a fresh clove of garlic. All right, so now we're going to add in some apple cider vinegar and some maple syrup. This is going to simmer for about 8 to 10 more minutes, and then we will have our squash ready and we will mash it all together. All right, so the squash is out of the oven and it is nice and soft. It's been in for just a little over 20 minutes. So now I'm going to add in the squash to our caramelized onion mixture. As you could see, the liquid is mostly absorbed in here right now. Just gonna get this all added in. So now as I told you in the beginning, made 2 pounds of squash and 1 onion. This is going to make enough for several recipes. You could use it as a side dish. We're going to, right after we put this together, we're going to make it into the butternut squash risotto, which is going to use about 1 cup. But there will be plenty left over to make more meals this week. with this mashed butternut squash. I already know that tomorrow I'm going to make grilled cheeses for lunch with this spread on it. And I'm probably even going to make a pizza with it with some Alfredo sauce and broccoli. It's one of my favorite things to make too. All right, so we've got all this squash in here. And I'm going to grab my potato masher that I use to make mashed potatoes and just mash it all together. It smells so good. I wish we had smell vision through the camera here, but you're all going to get to enjoy this as part of lunch very, very quickly. So it looks very much like mashed potatoes. It's just the butternut squash all mashed up with the onions. Alrighty, it's time to make the risotto. So before we get started on the risotto, I just want to show you, I took out about 1 cup of the mashed butternut squash, and this is what I have left over. As you can see, there is quite a lot left. This is more than enough to make at least 3 or 4 more meals out of. So you are going to have quite a bit of this mash left over. It is delicious, so definitely use it. Don't let it go to waste. So to make our risotto, we're going to start by putting 2 tablespoons of butter into our pan, as well as just a little bit of olive oil. We're going to let this heat up until it's nice and sizzling. It doesn't take long. And then we're going to add in some chopped garlic. We're just going to cook this for about a minute to let it get nice and fragrant like before. And then here we have 1.5 cups of arborio rice. This is the rice that's used to make risotto. It's a very short grain rice. It's very starchy when it cooks, so you get this nice thick mixture. So I'm going to go ahead and add the rice in to the pan, and I'm going to stir it to coat it with all of the butter and olive oil. And we're going to get it toasted. So this is going to be ready to start really cooking once the rice starts to smell toasty. It almost is going to smell like toasted nuts. It smells so good already. I wish you could smell the garlic. So we're just going to stir it for about 30 seconds. So as the rice is getting nice and toasty, you're going to see the grains really start to change in appearance. You're going to see that they are getting a little bit translucent. They'll be a little bit thicker white in the middle, and you'll really be able to smell that nutty, fragrant smell. And that's when you'll know that you're ready to add in your white wine. So I am going to go ahead and add in the white wine. This is serving a couple purposes. One, we're going to deglaze the pan where little drips of garlic might be stuck to the bottom. And it's also going to add really, really amazing flavor. So we're going to let this cook until the wine simmers down and you almost can't see it anymore. So we want the rice to absorb all of that liquid from the wine. And of course, you don't need to worry about alcohol being in this dish, as it will entirely cook out by the time that we're going to eat it. All right, so the wine is almost fully absorbed now. And it's time to add in our chicken broth. So this is some homemade chicken broth. I make this quite often and keep it in the freezer for when I need to use it. But you can also buy any store brand gluten-free broth to use in a risotto. So I'm going to add in, this is 3.5 cups. I'm going to add maybe a cup, maybe a little bit more. I didn't measure exactly to the risotto. And I'm going to stir this in like I did with the white wine. So risotto is a little bit of a labor-intensive dish, in that it works best when you continue to stir it along the way and add the liquid in slowly. So as I said, I added in about 1/3 of the liquid right now, and I'm going to cook this until it absorbs. And then once it's absorbed, I'm going to add more. And I'm probably going to do this 3 or 4 times until we have all of the chicken broth in the risotto and the rice is fully cooked. It will probably take you about 15 minutes to do this entire step. If you don't have that kind of time and you don't want to be standing here stirring, that is a-okay. You can also pour all of the liquid in and stir, and then you can cover your risotto with a lid, come back and stir it every few minutes to make sure that it is not sticking to the bottom, you're not burning the rice, but you can do it this way. All right, so our
chicken broth is almost fully absorbed now and the rice is fully cooked. So it's time to add in our mashed butternut squash and caramelized onions. So I'm just going to add that whole cup of mash into the butternut squash risotto and give it a stir. It will seem a little bit thick at first, but it should go right in and just turn your risotto into this beautiful, delightful fall dish. So I like my butternut squash just slightly chunky because I prefer it that way. But if you like things to be very, very smooth, you could even run this smash through a food processor to get the chunks out. Your kids might not like chunks, mine are okay with it. It just really depends on your personal preference. But either way, it will taste the same and absolutely delicious. So I have my little tasting spoon here and I'm going to go ahead and taste it just to see if we need any salt. Always blow. That is so good. We need just a pinch of salt. And it should be absolutely ready for dinner. You can serve it just like this. You can serve it with some roasted vegetables. Some grilled salmon is great with this risotto, or just on its own with a salad. You can also top it with some Parmesan cheese. It smells so good and I am so hungry. So I am going to stop now so that we can take some questions from the audience and get on to lunch.
You enjoyed the cooking demo? And before I turn it back to Alan for questions, just thank you to our whole Boston Children's team. We truly have an amazing group here. So thank you to all of them.
Please come to the microphones if you have questions here. We have some questions online. Actually received two for Dascha Weir about the origin of children with celiac disease being picky eaters. Is it possible that being the picky eater is because they're having abdominal symptoms?
There you go. Yes, is the short answer. I think that there's a lot of different reasons why kids are picky eaters, but I think one reason can be when kids associate food with discomfort or not feeling well. And I think that sometimes kids will self-select foods that don't make them feel well, or then just have associations with even foods that don't contain gluten. They just are less open to them because of that association with not feeling well and with food. And we sometimes see patients who we diagnose with celiac disease, and the family will report to us that they're the kid who takes the bun off the burger, and they're the ones who avoid gluten-containing foods. But yes, is the short answer.
Great, thank you. Sharon, is it common for patients or individuals with celiac disease to also be sensitive or intolerant to dairy?
Yeah, especially at first when they're first diagnosed, because the surface of the villi is where our lactase enzyme is. So when first diagnosed, you might have less activity from lactase, and so digesting lactose containing foods might not be that comfortable. As the healing process goes and those villi grow back, the lactase enzyme should grow back, and then usually dairy is better tolerated again, but not always. So you can always use lactose-free foods, lactate tablets. But in general, I think that lactose tolerance improves with the healing process. Yep.
Great, thank you. And for Vanessa, can anyone in the public attend the cooking classes? Or what do you
Yes.
recommend for celiac cooking classes?
Yes, so we offer free cooking classes that anybody in the public can attend. They are monthly, and you can find out about them on the Celiac Kids Connection website. There are some people that just log in and watch the classes, others who prepare all of the ingredients and cook alongside. So lots of different options.